I would like to acknowledge the traditional owners on the land in which we're meeting today, and I pay my respects to elders past, present, and emerging, and to any Aboriginal or Torres Strait Islander people that might be on the call with us today. I'd like to extend a warm welcome to Joel Sharrock and Lauren Clark, who join us from Canteen. Joel is the manager of Canteen Australia, Australia's Victoria and Tasmania offices, which are a national charity that supports young people from the ages of 12 to 25 and their families impacted by cancer. He's a social worker and trained family therapist with extensive experience supporting young people and families. Prior to joining Canteen, he has worked for many years with Headspace and for the Alfred Health Child and Adolescent Mental Health Service. The focus for today's session is how to support and communicate with children and young people about cancer, a Canteen perspective. So over to you, Joel. Thank you.
Thanks, Alison. Thanks for the introduction. So I've got a bunch of slides to go through today and talk to content. The session today is non-interactive, but definitely time for questions at the end. In the slide, you'll see reflection points. Usually when we run this session, it's interactive. So at those points, instead of offering questions to the group, I've just put a reflection slide. So we'll just pause and have a think amongst ourselves. So just to highlight that at the start of the presentation. So just to echo Alison's acknowledgement, so I also acknowledge country. I'm particularly coming from the land of the Boonwurrung people today, and pay my respects to their peoples and also peoples of the Kulin Nation. I also extend that respect to the elders past, present and emerging. Canteen works towards a reconciliation action plan in our work with young people and families impacted by cancer. We also do have a culturally responsive framework that underpins our service delivery as well. So please know that if you're ever reaching out to Canteen, we're seen to be very much a culturally safe service, and we really strive for that. So, and thank you for letting me join today. So Alison's given my introduction, so I'm presenting to you this content today. My name is Joel Sharrock again, Victorian Tasmania Canteen Manager. Canteen's got offices all around Australia in major cities. Our offices in Melbourne and Tasmania are based in West Melbourne and also in Hobart. But Canteen very much provides a digital support service to people as well. So we offer remote support despite being based in CBDs, and we really aim to provide rural reach in what we're doing with young people and families impacted by cancer. To clarify, there'll be time for questions at the end, but during the session, again, it will be non-interactive and there'll be points for reflection during the presentation. At the end, the presentation at a later point will also be shared through Pancare's YouTube channel, and this session will be recorded, as Alison said as well. So following the main content of the slides, there'll also be a resource section where I'll just mention some main resources, but please know that there's a plethora of really good health information out there relating to cancer and supporting families with cancer. So although I might mention a couple, there's tons of good information out there. So always seeking information through reputable sources is really important, but please know that what I go through in the resource section is limited, I suppose. So for those of you who don't know, Canteen works with young people aged 12 to 25 who have had cancer themselves, are dealing with a parent with cancer, are dealing with a sibling who has cancer, are coping with the death of a parent or sibling as well. We also now, in recent years, support parents across the age range from 0 to 25. We've got an alliance with Camp Quality and Red Kite Child Cancer Services that support the under 12 age group. But we provide specifically a Canteen service between 12 to 25. We have an alliance partnership with those guys called Cancer Hub, which is seen to be an online free one-stop shop for families getting cancer support from that 0 to 25 age group. So the basic referral criteria is that any family with an immediate family cancer with a child or young person aged between 12 and 25 is accessible to our service. So that is the main referral criteria. As we go through today, I'm presenting about parenting through cancer and communication in families around cancer. When we talk about parent, we're using that very much traditional language of a parent, but we acknowledge that parents these days and families these days are very broad, and there's a more general sort of definition that, or more nuanced definition, sorry, that can sit with what a parent is. When I mention parent, I'm meaning guardian, I am meaning foster parents, kin, uh, grandparents as well. So any adult who is in the responsibility of a caregiver role with a young person can be classified as a parent. Apologies, it's not in the content that it has that more nuanced definition in every slide, but just to highlight that from the start. Okay, to begin, the way we like to work with families at Canteen and is what is also seen as best practice in youth and family work generally, is that highlighting with parents that parenting is tough. It's a really challenging experience, obviously, just being a parent, let alone when cancer enters a family's life. It can hit like a truck, for a metaphor. And again, parenting is tough. I've got two young kids myself, 6 and 4. They battle with me every day around what we have for breakfast, to get to daycare, school. It's a challenge. I can't imagine what it would be like if cancer got thrown into our mix as well. So just to acknowledge that experience is tough, I think is really important. And as we're talking about parenting in the context of cancer and hearing this content today, just reflecting and being kind to ourselves for those parents who are watching this or engaging in this material. We try to work with parents around this idea of imperfect parenting or parenting that's good enough. We try to work with parents in a way that acknowledges that every family is unique and every family's got its own strengths and resources that they can draw on to help navigate something as big as cancer in their lives. So I think that's very important to highlight and to start in our work with any parents that we're coming across with at Canteen. Through this presentation, we'll hear from Cassie, who's one of our youth ambassadors at Canteen. There's a few videos where she talks about her own experience with her mum having cancer and some of the communication that occurred in her family during that journey. There's short recordings. Cassie is one of our youth ambassadors at Canteen. A youth ambassador at Canteen is a young person that's been trained through Canteen to tell their story in support of Canteen and also in support of the young person experience around cancer. So our youth ambassadors do training through the service, and then they do media opportunities. They give consent to share their story in platforms like this. And we very much appreciate Cassie and the other youth ambassadors in our service and their showing the level of honesty and braveness in sharing their story. So today in the presentation, we will cover parental concerns around cancer and young people, considerations and conversation prompts in family around communication around cancer. We'll also talk a little bit about common reactions that we find from young people when cancer enters a family's life. Again, this is non-interactive, and I'll try to go pace through the material. As I said before, there's reflection points as well. So we'll just take a brief pause as we go through. Along with acknowledging with parents that parenting is tough, another thing or another main way of working with parents or a stance that we take at Canteen, but also in just good youth and family-based practice, is this idea that every family is their own expert. So every family knows their kids the best. They've been with their kids, obviously, from the start of their life. What you might read in a textbook, what you might hear from me, what you might hear or see in the slides might not exactly fit with your family. And it's important to acknowledge that nuance, I think. There are some general tips and ideas around communication in families, but you might hear things that you just know aren't going to work, or you might need to tailor to your own family. So also in going through this content today, just please apply that lens to your own family as well. Sorry to what you're hearing, where you're thinking about how this might fit or work with your own family. So the common things that we, apologies, my screen just jumped. I will get rid of something. The common things we hear about in our work with parents at Canteen. So just to clarify, Canteen works across the whole family system, including offering something called parent support, which is a brief intervention model that we offer around supporting parents in their parenting ability or parenting capacity in the face of cancer. So it's brief model. It's usually 4 sessions and done to very specific parenting and communication relationship type goals specific to the cancer experience. So just to cover that. But some of the things that we hear from parents through our work is that, and things that they worry about, is this idea of when should they be worried about their child. So cancer's entered the family's life. They're noticing the child or young person adjusting to that experience in a particular way. And often we've got parents contacting us unsure as to what might be a normal reaction or what might be more a challenging reaction that the young person's experiencing. So often we have parents coming to us wondering about that worry. Is how my child is reacting to this cancer in me? Is that how they should or normally be expected to react as a young person? And talking through that with a clinician at Canteen or elsewhere can be really helpful to support young people in families, along with also supporting the parent with their own stress that could be sitting or would be sitting there with the cancer experience in the family. We find that providing support to the child is providing support to the parent, and providing the support to the parent is also providing support to the child. So it's very much a systemic view in how we work with families at Canteen. We also get parents wondering about a change or loss of role in the face of cancer. So before cancer, they might have been in the family the main breadwinner, to use a traditional colloquial term, or they may be the main caregiver at home, and then cancer comes into their life. They themselves get a diagnosis, and that changes that role in the family. The young person or the child might therefore then step into a parental type role to support the parent through their illness and treatment. And through the work at Canteen and which other services do with parent, the idea of navigating roles and change of roles in families is a really key part of the way we work with people, or the way we work with parents in the context of cancer. The other big worries is around, and particularly related to communication, is when to tell young people about the cancer experience, how much to tell, particularly thinking around if a parent's diagnosed or when a parent's diagnosed. There might be also death and dying type questions as well, or worries around the child, whether the cancer is going to lead to death or dying relating to the parent. So those sort of questions and conversations in family can obviously be very challenging, and coming to somewhere like Canteen to help with planning and support around those conversations can be very important. There's also worry from parents around telling their child prognosis or even diagnosis, that it could unsettle the child. So that's a worry as well. And just generally parents wanting to reach out and to understand how to best support their kids in the face of cancer, and communication around it is a key referral reason for parent support. So again, just a brief pause here. It's not a question, it's just a more reflection for yourself. We'll just give it 10, 20 seconds just to think about any worries that you've had, particularly in your family or particularly with your children that you're trying to support or live with in the face of cancer. If you're watching the recording, you can pause if you want more time to reflect, but we'll keep going with the content live. So at Canteen, when we've got young people coming to us and wanting to support, these are the common things that we're hearing from young people in our work. So they're wanting to hear information about their parents' illness. They're wanting help with confusing feelings, emotions around the experience. We also hear a lot of want or need for peer connection and support from other young people who might have experienced something similar to what they're going through in their family related to cancer. There's also a big referral or need, or what we hear with young people is this idea of how the cancer is being communicated in the family, and the importance of open communication, and young people having that isolative experience around cancer in families where in certain families it might be hard to have these conversations, and information might need to be kept from the young person or child, and those sort of experiences for the child or young person can be worrying, can increase stress, distress. And what we hear from young people is that they want to hear and be included and know and to be open around it as much as possible, and as much as the parent feels okay with as well. We also hear from young people that they want time out and recreation from the cancer experience. So there's this idea with young people, they want to live a normal life in the face of cancer. And at Canteen, we do that through the programs that we offer young people. So we uh, take young people around camps. These can be therapeutic camps where we do some therapeutic content around cancer experience in families and with young people. It can also be recreation-based camps where we just take young people away to have fun and to get a break from what they might be experiencing in their life. The other thing to point out with time out and recreation is that we also offer something called short stays within Canteen, where we provide funding for a family to go away together and have a couple of nights away, away from cancer, away from the normality of life, and do something nice together, where they might go down to the beach or something and stay a couple of nights in a hotel, fully funded by Canteen. And so I suppose just saying that is an acknowledgement that young people aren't just the ones just needing time out and recreation in the face of cancer. You can sit across the whole family, and trying to create these experiences within the family can be really important, and Canteen hopefully can promote that in our work with people. So from here, we'll talk more about this idea of preparing or how to have difficult conversations around cancer in families. So there's a few main tips here on this slide where we really encourage families, parents to draw on their past experience and consider their family. So again, getting back to this idea that you're your own expert in your family, you know your family best, you know your young people best, you know what's going to work in the regards to conversation and communication. We also encourage families to try to be as open and honest as possible around communication with young people and children around the cancer experience. I say that, and it is easy for me to say. And I completely get that it's not easy to be open and honest around challenging things in families. Challenging conversations can be really hard, and it's by me saying you need to be open and honest is not me being flippant. It's just something that I think we can or encourage people to try to work towards with young people. It's also important to really think and plan about the where, when, who, and why when having the conversation as well. So we know from young people that they can engage in challenging conversations in specific individual ways. So a young person might like to hear information when they're out in the car with their parent. A young person might prefer to hear information at night or on the weekend, that type of thing. So having a knowledge of your child, knowledge of a young person, knowing what works best for them is really important, and to plan that when having conversation is really pivotal from what we hear with families at Canteen. This information, I suppose, that we'll go through around communication in families, it's relating to families impacted by cancer, but it's also, I suppose, best practice principles just around general communication in families, if it's cancer or other challenging conversations. So this is very much sort of tried and true information as to what is going to work for families in most cases. So here we'll hear from Cassie for the first time. It only goes for a minute, the video, but I'll press play.
In terms of the conversation stuff around how to deal with it, I found for Mum and I, it definitely worked best when we were in the car. I'm the type of person that doesn't like difficult conversations. So for us, sitting in the car was the best option because I love driving. I bought a manual car. Manual cars don't exist anymore. So for me, driving and even having my mum driving and I was in the passenger seat, the pressure of having to always maintain eye contact was taken off. And it meant that we could have a more engaging conversation because we weren't seeing each other. I also found that because I was a little bit older and I may have been spending time by myself or, you know, commuting to work because I needed to get a full-time job, fairly straight up because my mum had to take time off, so finances were a bit struggled. I found that having some of the difficult conversations on the way home from work or just on the phone were just that little bit easier.
And that is Cassie. Sorry for the abrupt pause there.
in terms of the conversation stuff around.
And hopefully I can jump slides. There we go. So now we'll go through some tips other parents have found helpful in communicating about cancer in their family. Again, every family is their own expert. This is general tips that we've found through the families that we work with. You might find different with your family, so just apply that lens to what you hear in the next few slides. So generally, and we'll break down each of these dot points as we go through the next set of slides, but generally we find that it's really important to be ready. And again, that idea of planning how and what you tell them, and when as well. The other idea is to keep language as simple as possible and age appropriate, to try to steer away from medical jargon as well, particularly obviously younger children. To hear medical jargon or to hear less simple language being used to explain cancer can be even more confusing. So trying to steer away from that. The other thing we know with young people is to really important when communicating with them generally, not just about challenging things, but generally is to not overload with detail or talk too much. So really trying to provide succinct, short messaging and allowing breaks in conversation as well. We also find that starting conversation with young people, showing curiosity, asking questions can be really helpful. Young people developmentally, particularly as they get older, in the teenage years, they really want to be consulted by their parent and caregiver. They don't want to be talked at or talked to. So coming to conversations with curiosity, asking questions, framing things from a question perspective can be helpful. The final one there is communication contract. So it could be an idea with your family to think about with your young person the best way, the best time, how to speak about cancer and communicate around it. And it could be that you want to come up with an agreed contract with your young person. So obviously it doesn't have to be in writing necessarily, but just even a verbal agreement that we only talk about cancer on the weekend type thing. Again, that could be something that you want to come up with in your own family. I'm not going to tell you what that contract needs to look like. So sort of touched on be ready as already and explain what that is. But to provide further information, it could be that making sure that when you're going to a young person to talk about cancer, that you've got the information that you're needing to possibly answer questions. You've got a good idea around possible questions that the young person might ask you. If you're not sure about things relating to your illness or needing clarification yourself, then ideally finding that information out before then bringing it to the young person could be something to suggest. You also want to have a good think about how much you want to tell them and at what level of detail and how to explain it as well. If you're a parent in a partner relationship, obviously drawing on the partner to try to understand or think through the best way to plan and have this conversation. Is there someone outside of the family who could be also worthwhile to be brought into the conversation to support it as well? So having that idea about families being a wide network these days, and we've moved well beyond the nuclear family. So is there someone in the external family or your community who could be brought in to help support the conversation? So just having a really good think and not rushing into the conversation is the idea with this one. The things you might want to talk about with your young person or that they might need to know. So could be that they need to know the type of illness you have. So whether that is just a broad statement around cancer and what cancer is, or it could be, depending on young person age and stage, it could be providing a more specific label around the cancer, such as a blood cancer or a tumor-based cancer. It can also be helpful to talk about treatment options, and when talking about treatment options and prognosis and also diagnosis, we also find with families that it can be really helpful to provide, again, can be difficult, obviously, but positive type language or affirming type language, future focused type language, that can really help to, I suppose, decrease possibly the worry, possibly the initial fright or stress that the young person might experience, where you explain that you've got cancer, but you also say something affirming like, I've got cancer, but I've got a really good health team behind me. The doctors and nurses at the hospital are going to really look after me, and I want you included in this journey with me. That type of positive type language, I suppose, not trying to undersell things, but just can be really affirming to bring the young person, I think, down to a level where they might be less worried or less distressed, despite there still obviously being some worry and distress. The other thing we find, along with being affirming in language or positive in language, is this idea that the parent will keep the child or young person informed. This is really important. You don't want to drop a bomb. I've got cancer, and then it's not revisited again, obviously. So again, that idea of conversation contract with the young person. I'm going to tell you about my cancer. And as I go through this, I'm going to keep you updated as best as I can. And I want to do that as your parent. So that idea around looping back on the conversation, keeping the conversation going, is very important for young people. And again, to help them with their experience, and to not let distress or stress unnecessarily sit there when it could be addressed through having a conversation or having a further conversation. The other final thing that says down there, and which we hear from young people, is that when a parent gets diagnosed with cancer, it can lead to guilt type feelings, or even shame as well type feelings. They might feel that they've done something to cause the parent to become unwell. So along with affirming positive language, this messaging, really strong messaging, that the illness has nothing to do with anything that you said or did or thought. Sometimes health things just happen to people. And that really affirming language with young people, that affirming message, can be really helpful, again, to sort of settle any sort of high distress that they might otherwise be experiencing. So again, this idea of using simple language, don't overload with detail. We know with young people and adolescents, from a developmental perspective, they need information to not be, they need information to be given succinctly and clearly, and in giving information in chunks can be helpful as well, rather than long sort of sentences or paragraphs. So the idea with this is that you're not overloading conversations with detail. You're asking permission to share information. You're taking the conversation slow. You're making pause in the conversation for time for questions as well. So, and asking the young person or child, when you're talking about cancer, is it okay to keep talking, or should we take a break? That type of thing. So, as parents, and I do this myself, we can often try to over-explain and jump in with problem-solving explanation of things that don't need explanation, such as what I'm doing here. So we can help ourselves as parents just to remind ourselves that to put a pause and to take a break, and to just sit in the moment and connect with our young person in a different way, whether that's through touch or doing something fun outside. That could be a better way than just trying to continue the conversation or to continue providing detail. Sort of already explained the simple language thing when we introduced these slides, so I won't go into it more, but if you are struggling to understand or know how to simplify language around cancer, definitely speaking to your doctor or other health professional nurses around how they might have heard cancer explained to young people could be helpful. There's also great resources through Canteen. We've got a website which has resources on it. Places like Cancer Council, Red Kite, Camp Quality, we've all got child and youth specific communication material for young people and children with cancer. Red Kite particularly has children books to help explain cancer to children, and a lot of those books, Red Kite's a child patient service, and although they might be written from the perspective of a child having the cancer, that information, including those books, can be very applicable to a parent describing cancer to a child based on their own diagnosis. So I think I'm just saying that in that when you look at resources, try not to think about them as if this is directed to a child patient, that it's not going to fit with my family, because it might, and there might be good storybook resources that you can draw on that might not necessarily be easily available in the parent cancer space. Already touched on this, start with questions. I won't go into that more. We really encourage this wondering, curiosity approach with parenting. So if you're already doing that, great. But if you're not doing that, consider that as something that you could be doing. The questions that you could start with, just as some examples. So asking your child, do you know what cancer means? What do you know about cancer and this illness? Do you know what chemo means? What do you know about chemo? Those sort of questions type approach could be something to help. Again, include the young person in the conversation in a way that's going to work for them and likely to allow information to be more well received as well. This idea of communication contract also sort of already touched on this. Again, it's something very individual to families. I'm not going to tell you what that contract could be or should be, and again, that idea, if you're in a parent couple in your family, or if you have an external family member or a friend who could help create that contract, definitely encourage that. And again, cancer-specific services like Canteen or Cancer Council and elsewhere, that could be a really good sort of referral need to come to a service to talk to a health professional around how to contract communication in your family and what the communication plan could be around cancer. So what if you don't know the answer? So if a young person asks something that you're just not sure of, you acknowledge the question. You'll tell them that you'll check and come back to them. Again, this idea of closing conversation loops is very important. If you promise that you're going to get information, that you're making sure that you're always looping back to the child and finding out the answer. That's really pivotal and key. If we're not following up, coming back to them, it can again create unnecessarily uncertainty, worry, increased distress. So really important, if you've got an open conversation loop in the family around cancer or a question that the child's asked, definitely always be looping back. It is very important. Here we hear from Cassie again.
My mum was diagnosed with cancer when I was 17. In 2013, I was in year 12. I just finished completing my trial HSC exams, and we were in the 6 to 8 week study/holiday break before the final exams of my HSC. Her diagnosis came through quite quickly. I believe she was diagnosed from memory on the Thursday or Friday of the week, and she'd earlier seen the doctor probably on the Wednesday. It was within a day. She was quite careful not to say anything or hint anything at the time. What made me suspicious, though, is my mum is the type of person that never gets sick. She has never had the flu. She barely has colds. If she does, she's the type of person where it's so mild, you can still go to work. She never has a day off. She's the type of person where her company is begging her to have time off. So when I had to follow up from an injury with my GP, and that my mum was there with me, and she asked me to then leave the room because she needed to discuss something with the doctor, it sent a lot of red flags for me. Immediately, I was super concerned and worried. The rest of the evening, it was a little bit weird. It just didn't... It's like having that gut feeling that something's wrong, but you're not quite sure what it is. And you never want to jump to conclusions. The next day, I then got a call from my mum just after school and said that I needed to come home straight away. I believe I might have had plans to go somewhere or something, but I needed to come home. And she told me that she had breast cancer. At this stage, they didn't exactly know how aggressive it was, but they did know that it was aggressive, as they were still waiting for some further test results, and that she'd already, by the time she'd been diagnosed and I was told, she already had an appointment for her surgery to remove the cancer. It was absolutely life-shattering for me. My mum and I are best friends. She raised me as a single parent from day one. I don't have any siblings, so it is just her and I. At the time, we were both living with her parents as kind of the duo team to help out the old people, as we call them, with just the little chores and stuff that they just can't do on their own anymore. So when she was diagnosed with cancer, had her surgery, she went through full chemo, full radiation, I became the carer for my 2 grandparents and my mum, but I also kind of became the parent, which was really scary because I then had to start making decisions that I wasn't prepared for.
Okay, sorry to continue. Thanks, Cassie. Just this idea of children asking questions and you're not sure how to answer. We, as humans, often go to Dr. Google to find out what's going wrong with us or happening for us. We obviously wouldn't strongly encourage that for young people and can particularly contribute to anxiety and high distress as well. So when you're having conversation and communication with your young people, directing them to reputable, good information could be really helpful. Having that information on hand, services like Canteen, other services have booklets that can be provided. So along with thinking about what you could say verbally, also having those resources on hand, sorry, and trying to avoid Dr. Google as much as possible is very important. I won't pause here just because we're getting on in time, but if you're watching this and you want to pause, feel free to, just to reflect around have you had a conversation with your child and thinking about what helped and what didn't, and also thinking about any helpful hints or tips that would be good to remind yourself of. This can be relating to cancer, but it could also be relating to other good times that you've had or times where you feel like you've done good communication in your family and what did that look like, and trying to think about that could be helpful. So some common reactions from young people we see when communication in families about cancer has occurred, and particularly when a parent's getting diagnosed. So there might be reactions around the young person feeling sad, afraid, or angry / acting out. It can be, and just to highlight the point here, I think is really important, that for young people, if they are showing anger in the face of cancer or communication around cancer or other behavior that could be termed acting out, it's generally coming from an emotional place, and that's their response, and that's how their brain and body is responding to the news, the stressful news. So really encourage parents to try to take a non-judgmental type approach to behavior that might come up in stressful times in families, and trying to think about what could be the emotion underlying the behavior is really important. And again, trying to not to judge or come across as overly punitive, and to recognize and try to acknowledge that it is coming from an emotional place, and the parent's role could be to help the child process that emotion. We also find with young people that it can be when they hear stressful news or challenging, worrying information, it can lead to this underreaction as well, or not reaction, where they hear something very challenging. A parent has been diagnosed with cancer, and the parent might find that the child is under-aroused or not responding how they might be expected to. There might be no emotion from the child. They might be shut off. That can also be a very appropriate developmental stage and age thing when stressful information is being heard by a young person or child. Similarly, it can also be that the child is not upset, or what I've heard from parents in the service is that the child hasn't reacted to their cancer diagnosis in the way that they'd be thinking they would. There wasn't that upset. The news was given about the cancer. The child, relatively soon after the conversation, has then talked about what they're going to do for the weekend, and it might not match with what the parent was thinking that the response by the child could or should be. Again, with parenting, just trying to put yourselves in your child or young person's shoes, and acknowledge that from a developmental age and stage, them not appearing upset or them not reacting as you think they should might be very appropriate and normal, and not them not caring, if that makes sense. There's also big worry from children and young people around it being contagious, whether it's a genetic thing, and then they might inherit it. So that's something also we commonly hear. We also hear that there can be a report about there being positive aspects about the experience, sorry. The parent communication might be done well. It might be really affirming. The child, young person might have been picking up that something was happening in the family, and to have a good conversation about the cancer with the parent might actually settle things in the child and young person and actually be a positive thing. So just say that, I suppose, to encourage people to be open to these conversations. They're going to be tough and challenging, but they could also bring reward as well. The final one that we often hear in our work in cancer, in oncology, is this worry about death and dying. That is obvious why that might occur for the young person, and it's a very real thing that can be very challenging and difficult for a parent to navigate. Can be really helpful thinking about cancer support in families and when young people might need cancer support. If this worry about death or dying or health anxiety is getting to a level where it might need professional support, then parents' role is to could be to link the young person in to getting some good counselling support around that. I will play this.
All those symptoms.
But I'll just say that over the next few slides, I might need to skip ahead a couple just because of time, but we'll play this video.
Of what kids worry about is 100% true. I unfortunately am still going through the situation where mum's cancer is potentially genetic. And that's 8 years later. She's in full remission. She's 100% healthy now. But she's still getting tests done so that those tests can then be done on myself, so that I know what I'm looking forward to, if that's the right words, in my future. So it's just having those conversations. It may not be the answers can come straight away, is what Shay and Sally were saying, but it's just talking as much as you can. And then even if it's you talk for 5 minutes about all the crappy stuff, and then you talk about everything else under the sun for the rest of the time that you've got with them, it's definitely worth it. All those symptoms.
Again, if you're watching this recording, please pause and have a think about this reflection question. So what reactions have you seen in your child or young person? Again, something we hear at Canteen is this idea of parents wondering or not knowing when their child should need support or extra support or help. Again, this encouraging idea that you're the expert in your family. Use your instincts and parent intuition to identify if your child needs extra support. So parents are really good at knowing what is happening for their child, picking up on small changes and that other people might not be noticing. So paying attention to those, wondering about those, thinking about those, showing curiosity to changes, even if they might seem slight, can be a really good avenue to knowing if your child might need more support around the family's cancer experience. What can be helpful around supporting young people with cancer and communicating young cancer in families? Again, is this idea of open lines of communication. Try to be as open and honest as possible. We find it also helpful to keep to family routines. So family routine can allow predictability for young people and children, which can be really grounding and helpful. So cancer is very impactful. Obviously, treatment, for example, interrupts school drop-offs, etc. So, but that sort of predictability and routine can also be really helpful to help support the stress that's in the family. So trying to keep to routine normality as much as possible can be really helpful. We also at Canteen do a lot of work around values with families or young people, and particularly there's an approach called acceptance and commitment therapy. And that is a mindfulness-based psychological approach that helps people identify values and in themselves and their life and other relationships in their life, and how they might want to live their life based on their values and relating it to cancer in the face of cancer. So if you're not sure about values work or haven't heard of acceptance and commitment therapy, the person or the main guru around that approach is called Russ Harris, and he wrote a book called The Reality Slap, which is particularly around providing information to people who have had a reality slap where something's big entered their life and how to apply values work to that. So that's Russ Harris Reality Slap book, which could be something that you might want to look into. Again, this idea, you're the expert, be kind to yourselves, parenting's tough. Very key messages as well. So this is an old website that no longer that exists now, but I just put it here that if you've previously accessed our website, Parenting Through Cancer, and you're wondering where it's gone, it's just no longer on our website or as a website, but know that Canteen still provides parenting support. So it can very much be a referral avenue to Canteen. I mentioned at the start how we have an alliance with Red Kite and Camp Quality, and it's called Cancer Hub, and it's a one-stop shop for families who might want support around their cancer experience. It operates 0 to 25. Through this, if you're a parent with a diagnosis of cancer or a young person or having a young person with a diagnosis, then know that you can refer to Canteen through Cancer Hub. And the good thing about it being a one-stop shop is just because Canteen works from 12 to 25, but you've got some children 12 to 25, but some children 0 to 12, know that it's a one-stop shop to all three services. So you can do a family-based referral to get support. There's a bunch of resources, like I mentioned, around talking to kids about cancer or relating to cancer. There's some main websites there, but obviously Pancare is an option. And if you've got a cancer, a specific cancer need, generally there is a service similar to Pancare that you could research and look up and engage with. And again, there are child and youth specific cancer services, including Canteen, but also Red Kite and Camp Quality. So every one of us has a good website with lots of resources on our website. So if you're ever looking for written information, it's definitely very accessible and easily Googleable. If anything today has brought up anything for anyone, just know that there's support services out there. If you are watching this and do want to engage in support following this, know that you can reach out to places like Canteen. And I think the cancer field and oncology field is very well supported and resourced, and there is good counselling, good emotional support out there that families can access. This is the final video from Cassie where she just talks about the support that we offered at Canteen. So I'll just play this now.
I didn't join Canteen immediately. So I was first told about my mum's condition and Canteen pretty much at the same time. I was offered the services from day one, but I decided at that time that Canteen wasn't for me. It took, I think it was around 6 to 12 months for me to realise that potentially I do need the help. And it was more just the time, and for, as bad as it sounds, the time and reality to kick in that my friends didn't understand what it was like to have your only parent and your life flipped upside down. They couldn't understand why I didn't want to go out. They didn't understand why I bailed on schoolies to spend time with my mum. They didn't understand why I didn't want to go to study group because I needed to drive my mum to the hospital to go to chemo treatment. So for me, it was just, I started to feel so alone that I was trying to find someone to talk to that wasn't my mum, it wasn't her doctors. I just wanted someone else to go, this sucks, and have them understand what that means. So that's how I got involved with Canteen. And if I could give that advice to anyone in the same position, it would be, it may be scary and it may be daunting at the time, but once you get through that, it's the best decision that you'll ever make. You make lifelong friends that understand where you were as a person and then how that's changed you to be the person you are today. I never thought 8 years ago that I'd be talking on a webinar about how my life changed and how I'm now a bigger and better person than I could have ever imagined.
Just to highlight here that Canteen, we offer programs, like I said before, like fun camps, recreation stuff as well. And we also offer counselling as well. So some young people might not want to engage in counselling, and that's okay. And they can still come to Canteen to just do the fun stuff. So just to highlight that. And often we find or hear that young people aren't wanting to
I
engage with us. Reflection point, if you're watching this, please pause. Just rushing a little bit now because of time. Final slide. So nourish yourself. So as a parent, as a caregiver, again, this idea, generally it's tough, but also in the face of cancer, it's tough. And being kind to ourselves and showing self-compassion and showing compassion to our families is really important, and taking time out to recharge. And encourage after the session today, if there's something that you do for yourself that helps with that, lean into it. Summary of key points. So communication in families is key around cancer. Your family is unique. You're your own expert. You've got your own resources and strengths as a family to navigate this. And there is a lot of support out there, including written support, but also face-to-face support through services like Canteen. Final slides. Community education workshops. So Canteen's on our website got similar training like this, similar information sessions like this, but done in a more training form. It's all self-directed learning, so parents can access that, or health professionals as well. It's all self-directed and free. We've also got YouTube videos. A bunch of other cancer organizations have YouTube videos as well, so it's a very good platform to get information, including Pancare.
Cancer.
And I won't play that because it's going to take time. Socials, resources for Canteen. We've got our website. We're across all social media platforms. If you're on social media, please like, follow, etc. It's very helpful for Canteen as a charity. A large portion of our support isn't government funded, and we drive our own business. So how we get to do the work we do is through fundraising and donorship and partnership. So to promote our service through socials is very important to make our service sustainable. There's a feedback. If you're watching this, please pause and provide the response if you feel like it. And that is the end, and within an hour as well, by 2 minutes.